And many of you tonight are weighing the choice, obviously, between at home or in classroom learning for kids. Two prominent local hospitals have created a guide with the simple goal of trying to help you make the decision that is best for your family. Brooke Katz, live in the Fort Worth studio tonight with more details on that for us. Brooke?
Doug, there's certainly no one-size-fits-all approach here, but this was a massive undertaking that's been going on for the past several weeks by both Children's Health and UT Southwestern.
It's certainly rather robust, not necessarily comprehensive that can cover every particular situation, but it's rather thorough.
That's Dr. Jeffrey Kahn, Chief of Infectious Disease for Children's Health and also a professor of pediatrics with UT Southwestern. He's been helping to work on this guide, and it lays out different diseases and whether they could put your child at a low, moderate, or high risk. So for an example, asthma, if it's severe and persistent, is considered high risk. The guide recommends online and remote learning for any category that puts your child at moderate or high risk. It also helps parents understand specific drugs that can affect your child's immune system. With so much information out there, it can be so hard to keep up with all of that. And that's why Dr. Kahn says this is a really good starting point for all parents.
We're seeing hundreds of papers being published every week, and trying to keep track of this is very, very difficult. And I imagine for parents and think about other things going on and their children to take care of, that it would be nice to have one place where they can look and get some valuable advice.
And that's the idea. The guide also goes over other factors to consider. For example, a household's risk should be defined by the person in the household with the highest risk. So in other words, it's not all about the child, but do one of the parents or a sibling have high risk factors? Dr. Kahn says they're going to keep that site updated because, as we all know, as we learn more, sometimes those recommendations change. We do have a link up to the guide on our website, cbsdfw.com.